All right, here we go. All right, today's Zoom call, we're going to talk about keeping the gut healthy, keeping your gut healthy. And again, we talk to cancer patients about gut health, and you have breast cancer. You go, what in the world do I need to know about gut health? I have breast cancer, prostate cancer, whatever. But it is very important because it is really the beginning of all problems is our gut. One could argue, if you wanted to argue, I would argue the cause that the majority of our health problems begin with the gut. Because our gut, inside our gut, everything that you eat that goes through you is still outside of the body. If you can think of it that way. It hasn't crossed the gut barrier to get inside your bloodstream. It is a tube within your body. So everything's going within this tube. It's still on the outside of your body. So the health of that gut barrier, and we talk about that gut barrier, it is these little individual cells, these little enterocytes that create this barrier that allow things to get through that are supposed to get through. And if that barrier is damaged, it allows things to get through that aren't supposed to get through. And then that ends up causing an antigen immune reaction and causes antibodies to be created against food particles, against chemicals that it should never have been created antibodies, and that could just cause major problems and major inflammation. And that's where we get inflammation in the gut, inflammation in the body, inflammation in the brain, and it just becomes this horrible negative cycle that can cause a lot of problems and can actually lead to cancer. This can actually be a cause of cancer and all sorts of different diseases because it causes basically systemic inflammation. So these commensal bacteria react with butyrate and actually help create butyrate in order to feed the intestinal cells. Butyrate is the main food of your intestinal cells in order for them to be fed and nourished and to stay healthy. So this discussion, we're just going to concentrate on butyrate. Butyrate is also called butyric acid. It is formed through ingestible dietary fiber. That's why we put a lot of people on sun fiber or sun spectrum. The fiber in sun spectrum and sun fiber is the #1 studied fiber on the market. There are more research articles on the fiber that's in that product than anything that exists on the market as far as fiber goes. And it's the best fiber to make the most butyrate. That's why we use it. It ferments in the gut, creates butyrate, feeds your gut cells, decreases your risk and growth of colon cancer because you have a healthier gut, but also decreases the risk of all cancers because inflammation in the gut is going to equal inflammation in the body and the brain, and that can lead to cancer. Increases mucus production, a good mucus layer in the gut to help protect the gut against poisons, chemicals, additives, colorings, everything that's in processed foods that you're eating. That decreases intestinal cell permeability. So that permeability, that lack of permeability is what we want. When we have an increased permeability, that's what's called leaky gut syndrome. And that's what allows things to pass through that gut wall that were never supposed to pass through the gut wall. So we want to promote these, what are called tight junctions. The tight junctions keeps those gut cells tight together, keeps the gut cells healthy, undamaged, and doesn't allow things to get through that weren't supposed to get through. Decreases luminal pH. So we want that pH of the lumen, that intestinal lumen, to be lower, more acidic, and to stay that way to help continue the digestive process. Regulates Treg cells. Treg cells are the cells that will calm down an immune response. So when I have a hyperimmune response reacting to a food or something in my gut, I want that to calm down. Butyrate helps calm down Treg cells and modulates that immune response. We don't want that hyperimmune response inside the lumen of the gut because that's what's going to cause problems. Butyrate itself has all sorts of good anti-cancer tumor suppression effects to it. So that's why typically we put almost every cancer patient on that fiber to help stimulate natural butyrate production. Now, we do have butyrate products now that you can take butyrate itself directly. That's a product called Butyrin, and also Enterovite, which is uh, Butyrin is from Allergy Research product, and then Enterovite is a Apex energetic product, which is a good source of butyrate just to help this production. So it's a huge tumor suppressor in itself, and it's a great way to help decrease um, uh, uh, gut inflammation and increase overall health, and really decrease overall inflammation in the whole body. Now, how do I know if I have leaky gut? How do I know? What are some tests that I would do that would suggest that I have leaky gut? Well, first of all, before I get to the test, we could assume if I have any ill health problems that I have leaky gut. So the tests that we're going to talk about are some of the Cyrex tests. This is the Cyrex Array 4. This is similar to the Array 10, which measures many more things than this. The Array 4 measures, I think the Array 4 has just this one sheet. The Array 10 measures about 6 or 7 sheets like this, about 300 different foods. And this is how you can, if you want some evidence of leaky gut and evidence of your leaky gut being healed, and these are the kind of tests that you can run. Now, we don't run these on a lot of people because you could just make an assumption that you do, and it's make an assumption that you always need to work on your gut, and that's a very safe assumption. Now, people that want more evidence, we can certainly run these tests. These are blood tests measuring antibodies to different food particles. Again, our gut health here, back to this slide right here, should not let large food product particles in, and therefore you shouldn't develop antibodies to these food particles. But when our gut is damaged and we have increased permeability, meaning a leaky gut here, so it's letting large food particles in, we'll start creating antibodies to different foods, and you'll have a test that looks like this. All of these should be in the green. Now, I have run tests on people, and these are all in the green, all of them, which is a great test. Then you have to measure some other things to see, other damage that might be taking place, and that's these kind of arrays here that we'll get to in a few minutes. But usually if a person has ill health, they're going to have a test that looks something like this. Now, this is actually pretty horrible. This is on the worst side of a person's ill health. Where this is way out of range in the red here. Equivocal is still out of range, but in the iffy side. Green is in normal range. Now you see they have way more, maybe 3 times as many that are out of range than are in range, which this test suggests this person, should they stay off of millet, should they stay off of rice and corn and buckwheat and hemp and sesame and amaranth? The answer is yes. However, just staying off these foods is not going to fix the person's problem. When we have a test, when they're all green and there's just a couple yellows, then the answer is, yeah, if you just stay off those foods and continue what you're doing, that person is probably already doing a lot of gut healing. So if they just started staying off those extra little things that are causing inflammation, then their problem would be diminished. That's an easy one to go over with a person. But when a person has all these reds like this, then it's like, oh my gosh, you've just completely destroyed this person's life, because now they can eat almost nothing. And that becomes a little problematic, and people start throwing tomatoes and stuff like that at me, and it's not real great. So the treatment for somebody who's got a lot out of range here is you really have to concentrate really heavily on a gut healing protocol. That's the way that I've done it for years. You really hit them hard on a gut healing protocol. Have them stay away from as many of the red things as they possibly can. Don't worry about the yellows to begin with. Stay off as many of the things as they can. Get on a good gut healing program and see how their symptoms diminish. And then there's 2 ways to follow up with the person. In 3 months, you can run this test again. And you will see if they stayed on the gut healing protocol, some of these will be slid to the yellow, some of the yellows will be slid to the green. If they didn't, if you just stayed off the ones on the red and you didn't do anything for gut healing, quite possibly some of the greens could slide to yellows, some of the yellows could slide to reds. You could get worse. You have to fix the problem. So you have to go back to this and understand that you have these permeability issues in your gut that have to be corrected. Just staying off the food is not going to solve the problem. Staying off the food is going to decrease a source of inflammation. So in a way, it's going to help, but you have to heal those holes. You have to patch up the holes in the dike, or as soon as water comes down, it's going to leak right through again. So this is an example, again, of someone with a really bad leaky gut problem. This is pretty bad. You could go further into these and look at each one of these. Cyrex, this lab who does this, has an individual panel on each of these, individual paper on each of these products. So for instance, it's not on this, this is from Cyrex 10, corn oleosin is a product is a food product that they test for antibodies. And it tells you, it explains what corn oleosin is, explains where it comes from, what's associated with, gives you some data and some known cross reactions. Now there's no known cross reactions for this, but on other things, there are known cross reactions, like wheat and alpha-gliadins has a lot of different known cross reactions. So if a person had only wheat and alpha-gliadins positive on their test, then they'll want to stay away from that, but they may want to stay away from all these things too. So this just gives you more detail on how to help a person heal that has major gut issues. So it's a really good test to give a lot of data. The problem that people have with it is it's too much data, and it can become extremely overwhelming, and I understand that. And I really need to make a whole presentation just on the tests themselves and how to interpret that, because that might be more helpful. We're just doing an overview here. But this gives you some information on how to start. But really, when you have a test with a lot of reds, you really have to concentrate on the gut healing protocol more than just staying away from the foods. There is another panel that Cyrex has that's a newer panel. It's called their mucosal immune reactivity screen. It's a really nice panel, and it's becoming my favorite panel because it tests all these things. So it's bypassing the food sensitivity, even though it does have some foods in here, and it's jumping more to some of the other markers that would be positive for gut health. And again, does a person need to do this test? The answer is no, a person doesn't need to do this test. Personally, I have never done this test. I just assume, because of my issues, that I have gut damage and I need to be on a gut healing protocol. So these tests are not super cheap, but they do give you valuable information that gives you some direction to go, especially if you can't quite put the finger on what the cause is. When you do a Cyrex Array 4 like this one is, or Array 10, which has about 7 pages like this, it could be really nice, especially when there's just like one food or something that you had reacted to that you couldn't figure out what it was. And this is very common with people that were like on a good diet, a dairy-free, gluten-free diet for some time, and then we do a test like this and find out that they're reacting to tapioca starch. And they're like, oh my gosh, that's in all my gluten-free products that I'm eating. No wonder it is. Now I can put a finger on it. Now it brings back to their mind that that's why they have a reaction after they eat their gluten-free bread that they eat. So that's where this test really comes in handy. But people that have, cancer or serious disease, is it necessary to do this test? Not really. We're going to treat your gut anyhow. But when you start to clear out the cancer and that's calmed down, then it's a good time to do tests like this to get more specific to your diet and to see if there's anything that you're eating that's causing inflammation that's hidden. So that's just a brief overview of the gut tests and a brief overview of the benefits of butyrate and why we have you on what we have you on. So we got to keep that gut healthy because now many of you are doing much better with your cancer, and you're thinking about not wanting to get Alzheimer's disease or not wanting to get Parkinson's or any type of early dementia or something like that. Well, it all starts in the gut, I'll tell you that. I'm going to put together an Alzheimer's protocol or a presentation here in the next couple of weeks, and it's going to be mainly on the gut. So we're always keep hounding this issue, but inflammation in the gut equals inflammation in the body and certainly inflammation in the brain. And we're going to talk about that gut-brain connection in that presentation. All right, so I am going to unmute everybody and allow you to ask questions for a few minutes. You have it.
Dr. Connors?
Uh-huh.
Hi, it's Lisa from New Jersey.
Lisa.
How are you? I have a question. Okay, so I have 2 root canals on my bottom left. They're number 18 and 19. Yet my breast cancer tumor is on the right. So is there such a thing as like crossover the meridians? Like a lot of times in the same meridian is where the stuff happens. That's part of my question.
Okay, you want to answer that first?
And then zirconia implants versus titanium implants, because I'm assuming that ripping the teeth out is the best way to go. And then the holistic dentist I saw wanted to get my vitamin D levels up. He tested me right there in the office, and I was at 45, and he said, like you need to be up at like 70. And he gave me a liposomal vitamin D and K2 and said to take like 20,000 units a day.
All right, so let's address those. First of all, if my dentist said he wanted to rip out the teeth, I think I would go to a different dentist.
He didn't say that.
Okay, good. Thank you. That would not be the appropriate adjective that I wanted to use. But, okay, so, all right, so meridian crossing. So first of all, I don't think that the relationship of the tooth, the bad tooth, if it is infected, that how it negatively affects the breast is via meridian. So I'm going to mute everybody because I'm getting some feedback here while I do this. So the issue with cancer in bad teeth, in unhealthy teeth. So let's take a step back a little bit farther from that. So if I have a root canal goes in there and reams out the nerve and the blood supply to that tooth. And it saves the tooth, quote unquote. Yes, you have this tooth that's still in your mouth that's unhealthy. It's really a dead piece of tissue that's in your mouth. And if you can look under a microscope at your teeth are just this array of holes in that tooth that can become now a hotel, a ginormous resort for bacteria. So an infected tooth is not going to be able to be seen on any x-ray unless it's infected into the tissue and you have actually an abscess. So many dentists will say, well, that's crazy. Your tooth isn't infected. I can take an x-ray here and I don't see any infection. Well, unless you have a full-blown abscess, you're not going to see it. What we're talking about with a root canal is that it basically can house bacteria that then can leach into your body. And because it doesn't have a blood supply, you can take all the antibiotics in the world or nutritional type antibiotics. That's not going to get at the tooth because there's no blood supply to the tooth. So that's the danger, or I should say, let's make it clear, that's the possible danger of root canal teeth. So that doesn't mean every root canal tooth is full of bacteria and is a breeding ground of bacteria. That's number one. Number two is, even if it has bacteria in it, it doesn't mean that your body isn't able to readily kill those bacteria when they come out of the tooth. So let's not jump on the bandwagon that every root canal tooth should be removed, because I don't believe that to be true. So if that root canal tooth is causing issues elsewhere in the body, well, how would I know that? Well, do you have chronic sinus issues? Do you have breast cancer or throat cancer or lung cancer on that side? No. Okay, well, then there's a chance that that tooth might not be causing it. I believe in testing with kinesiology, whether that tooth is a problem and it should be removed. So if you go to somebody who's a kinesiologist that you feel have confidence with, I personally would not remove the tooth unless I felt like it was a problem. So that's main thing. Secondly, if it is a problem, I don't think it is because of the meridian system. The meridian system is basically your energy system that is spoken about through acupuncture. And that is, your bacteria are not going to travel through a meridian system. The meridian system is a system of energy. It's not actually a portal for any travel of any, bacteria or viruses. What's happening with cancer with an infected tooth is that it's literally, the bacteria can go right down the lymph to that breast or to that lung and to that side. Can it travel across and get down the other side? Possibly. The chance of that happening is slimmer, though, so it's not nearly as common. Is anything possible in the body? Anything is possible. So I would say if those teeth don't test out as being bad, then I would probably go to somebody maybe different than your dentist if your dentist does the kinesiology, just because there's a bias there. So I would test those out. If those teeth don't test out to be bad, I personally wouldn't remove the teeth, because there are issues in removing the teeth and getting implants also. And then on to your question about implants is, what's the best implant to use? So far, we haven't seen any issues with titanium implants. I know that there are some dentists that are using porcelain implants that are said to be even less hypoallergenic, more hypoallergenic, less problems with any sensitivities, but quite honestly, I have not seen anybody with sensitivities to titanium yet, not that it might not occur. That's why, that wouldn't be something I'd want to jump into either, besides the struggle of going through all that. So I'm muting everybody again. So does that help answer that question, Lisa?
You always answer more than I expected, and it's wonderful. And now what is interesting is my last 3 thermographic image have shown heat. So the breast tumor, there's no heat there. I've been good. But in that area and my thyroid, it always shows heat there. That's why
at that area where the teeth are?
Where the teeth are. But I have to say, I really don't have any problems, but it's just always in my head. But thinking of getting, they're right next to each other, 2 implants, and he's talking about taking the teeth out and putting the implants in right in the same day, and it's just like, it's a big deal. So I think with you saying do the kinesiology testing, I may try that also with the functional doctor, just to, help me if I do it or not do it. I don't know. Just it's.
Well, I think it's a big deal, and that's where I try to that's where when we see that with thermography, I know that I've trained Angie to get people to start using like a tooth gum oil or something like that to try to deal with it without having to go into a full dental surgery, because that can cause issues too. Just going through the surgery, getting your teeth pulled, that can be an issue. So, you could be as conservative as possible. I think you're going to be better.
All right, that's good. And I use your gum oil. I love that gum oil. When I had issues with the top tooth, when I came to you, the 2 days that I was there on the Rife, it was doing something. This is another tooth. That tooth has since been extracted, but it was extracted when I came. I had issues with it. The 2 days on your machine there, a lot of activity, and then it was better after that. And and then I used the tooth gum oil. But all right, so see, you just have shed light on a whole nother. I thought, oh my God, I got to get this done. I got to get it done. Now I'm just gonna think about it and do more testing and whatever. Okay.
Okay.
Thank you.
You're very
Dr. Connors, Norm had success in using the right on the setting for what was it? It was related to the
sure.
It was very interesting because our biological doctor was set up to pull it, and Norm couldn't because at that time he was on the blood thinner. But then in the process, he's telling us this story about a person that had come to him with this horrible infection, and he said, I can't do anything about it. The man came back in a few months, and it was totally healed. And he asked, what did you do? He said, I used the real rice machine. So the dentist went out and bought one.
Oh, that's funny. Yeah, there's a biological dentist near us that's very positive for the rice machine and uses it a lot too. Yeah, using the Rife machine, obviously, that should be your first go-to. The dental foci, the dental settings, the dental infection, the tooth. There's probably about a dozen dental programs. So root canal, those are things to use too. And the frequencies will penetrate the teeth. That's the benefit of the Rife machine. Whereas taking like an antibiotic or something, nutrition orally is not going to get inside the tooth. So the frequencies are going to go right through it and can help knock the bacteria down. So. Good. Any other questions?
Dr. Connors, I have a couple questions to ask you.
Uh-huh.
This is Donna from Arkansas.
Yeah.
Actually, Mike is with me, and he has a question for you.
Okay.
We were watching your video yesterday on the pathways for pyruvate, and yes. my question is there a bread that would fit into this pathway that wouldn't cause your pyruvates to go in the wrong direction, you have the left side and the right side? And the second question regarding that is, does yeast break down the sugar when it's an ingredient in the bread?
So, is there a bread that you can eat that will help with pyruvate, that won't push towards pyruvate? That's the question?
Yes, sir. Okay,
so no, there isn't. So the pyruvate pathway, is there if I mute you while I do this? I'm getting some feedback.
Yes.
So the pyruvate pathway is a sub-pathway of glycolysis. So glycolysis is where glucose breaks down to make ATP and then ultimately to acetyl coenzyme to go into the Krebs cycle. So pyruvate is made in that pathway, especially when it's a more hypoxic condition or it's a stressed condition, and then cancer can feed off of pyruvate. All of carbohydrates will ultimately break down to glucose. So there isn't a bread that is not going to feed that pyruvate pathway. However, the more complex a carbohydrate is, and the lower the glycemic index is in any carbohydrate that you eat, the slower you will feed into glycolysis. So a perfect example is I'm going to have some potatoes. Well, white potatoes break down to glucose very quickly, therefore that has a very high glycemic index, and it feeds down glycolysis really quickly. But sweet potatoes have a very low glycemic index and break down, because it breaks down to glucose much slower, and therefore it's not going to feed that pathway quite as quickly. Most of your grains that you're going to eat, even if you're eating gluten-free bread, are going to break down quite quickly. So there really isn't any grains, and you can look up the different grains if you just search glycemic index of different grains, but I'm suspecting that most of them are going to be about the same ranking. So no, there really isn't. However, you can slow that pathway in other ways by eating your carbohydrates mixed with a protein. So let's say I'm going to eat some bread, but I'm going to have a piece of bread with a toast with my eggs. So I'm eating proteins with my toast. I'm going to slow that down just a little bit more. So if I'm just eating straight carbohydrates, I'm going to speed up that process. So you can't live without eating some carbohydrates. So we have to eat some carbohydrates. That's not the point. It's that we're trying to eat more complex carbohydrates. The other thing to look at is really important, and I think it's an easier way to look at food. Try to eat it as close to the way it was created for us to eat. Fruit is high in carbohydrates. Yes, but a whole pear has a lot of fiber in it too. So that fiber helps offset the carbohydrates in there. So that's how you get that balance. But if I was just going to drink pear juice or orange juice, you lose most of the fiber, you lose almost all of the nutritive value of it, and it just becomes just basically sweet sugar water that tastes good to you, and it has no benefit to you anymore, and all you're doing is feeding glycolysis directly, really strongly. So it's not a matter of not feeding glycolysis. You have to feed glycolysis in order to survive because you have to make energy. It's a matter of how fast you're running down that pathway. So there isn't any breads that I would say that are probably better than the others, but eating other things with it, eating a lot of fiber with that bread or proteins with that bread is going to help, and that will help slow that down.
Thank you.
You bet.
Dr. Connors, I had a question also concerning a few years ago, I had to have my gallbladder removed. Does that keep my gut from healing because I don't have the gallbladder anymore?
No, it doesn't. It doesn't keep your gut from healing at all. You do have to be careful. So what does your gallbladder do? Your gallbladder is basically a storage sac for bile. So bile is, I'm going to have to mute everybody again. So bile is made in your liver, and bile is so important. So just because you don't have a gallbladder doesn't mean you don't have bile. So bile is what conjugates with phase 2 conjugates, which is a big term that means this is how your liver detoxifies. So when you have, let's say, pesticides in your food that you ate, gets into your bloodstream, goes through the liver, it conjugates in phase 1 detoxification in your liver, binds with bile in phase 2, and it gets excreted through the bile duct into the gallbladder. Now, bile serves multiple purposes. Bile grabs onto toxins in the liver and helps those toxins get down through the bile duct and get dumped into the first part of the small intestine in order to eventually, if you don't have leaky gut issues, to exit the body in the next bowel movement. Bile serves a secondary purpose too, which is what you hear about all the time when a person has their gallbladder removed. Bile helps break down fats. So dietary fats we're talking about. So fats that you ingest, that you ate, you just had some good coconut oil, and now it goes into your stomach and then goes into your small intestine, gets sensed by your small intestinal cells, tells your liver to contract, your gallbladder to contract, and bile is squirted out into your small intestine to help break down that fat. If I don't have a gallbladder anymore, I don't have that storage sac. So now when I eat fat, all I have is this trickle of bile from my liver. As it's being produced in my liver and as it's being secreted by my liver, it's going right into my small intestine, even though I haven't eaten anything for 3 hours. So I have this constant trickle of bile into my small intestine. I don't have that storage for it to be secreted when I really need it. I just have this small trickle of bile all the time. Well, that becomes not problematic at any time that I'm not eating fat, but it becomes problematic when I do eat some fat, and now I don't have enough bile to break down the fat that I'm eating, and then I can have some digestive issues. It shouldn't hurt my gut wall. It shouldn't decrease my ability to heal my gut wall and to keep my gut wall healthy, but it does become a problem of digestion of that fat, and I don't get the benefit of that fat because you need fat in your body also. That's what all your cell membranes are made of, right? That's what your brain is made of, as fat. So you're eating coconut oil to help your brain and to help you prevent dementia, but you can't even absorb it because you don't have enough bile in there. So you can help this issue. So I recommend people with no gallbladder to also take bile salts. You can take bile salts. We have a product that is called, it's called Ox Bile. That's what it is. So it's a allergy research product that we use. We got a 500 milligram and a 100 milligram of Ox Bile that you can take. Oh, I'm going to eat a meal, and there's considerable amount of fat in the meal because I cooked with coconut oil and I'm trying to eat right. So I'm going to take one of my Ox Biles with maybe my digestive enzyme with my meal that will help solve all that problem. We also have another product by Designs for Health called LVGB that has Ox Bile and digestive enzymes in it all in one. But taking Ox Bile with your meals, especially with a fatty meal, if you're eating like a snack that doesn't have a lot of fat in it, you don't have to eat that. But if you're going to have a meal, that can help with that. Long answer to an easy question: does having a no gallbladder affect my gut? The short answer is no.
That's really good news because I'm taking Ox Bile. I found out through a friend about 2 weeks ago. So I bought some, and I've also been reading a book on what happens when you lose your gallbladder. And Ox Bile was one of the things that he recommended in the book.
Yeah, that's good.
He confirmed it for me, and I appreciate that a whole lot.
Oh, you bet. All right, I think we're going to have to bid adieu for today. Thanks for everybody for being on, and we will see everyone next week.
Thank you, Dr. Connors.
Thank you.
Thank you very much.
Enjoy.